changes during pregnancy. There will be enlargement of the breast, tenderness of the breast. Okay. Remember pregnancy test. Pregnancy test. What hormone they detect in pregnancy test? What hormone
HCG.
exists? HCG. Good job. So HCG hormone. Again, toxoplasmosis, avoid raw meat and cat litter. Change the litter box with your gloves off. Remember how to do the GT-PAL calculation? You know gravity versus parity. What is gravity, guys, versus parity? What is gravity? Number of?
Pregnancies.
Yes. What is parity?
How many
Parity.
births you
Premature.
gave? Births.
Labor, birth, labor. Very good. Times of labor. So no food in labor, restricted food, remember? And if she is in labor, by the way, remember, don't leave the patient unattended, because if she feel like the urge to go to the bathroom because the baby is pushing on her bladder, so she might feel the urge to go to the bathroom. If you leave her unattended, she might go to the bathroom and you will have a bathroom risk, labor in the bathroom. You need to be ready with this, okay? Newborn care. Okay. If you are watching electronic fetal heart monitor and there is persistent tachypnea, like there is very fast breathing, and very fast heart rate. Yeah, so you might expect C-section will be happening. Remember, hypoglycemia is expected in patient with gestational diabetes mom. Make sure you check blood sugar. Baby will be jittery, and feed the baby as soon as possible. If the newborn is gagging, you need to do the suction. How we do the suction? You do the mouth, then the nose. Okay. If there is any color of meconium, make sure you do the suction and the airway is clear. You might get unfolding case study on gestational diabetes, so study that very well. Also, you might get unfolding on dehydration, a newborn with dehydration. So how you weigh, what indicates dehydration? What is the most accurate parameter indicate dehydration in a newborn?
Is it like the sunken fontanelle?
Sunken fontanelle?
Sunken fontanelle, sunken eyes, skin turgor, but what is the most indicator?
If the amount of diapers they wet?
Exactly. Weigh the diaper. Weigh the diaper, because the amount of urine output is the indicator of dehydration. They might ask you sunken eye or sunken fontanelle or the skin turgor. All of them are indicator of dehydration, but the most accurate one is the diaper weight. So weigh the diaper. This is the most accurate indicator. We talked about, okay, buggy uterus. We talked about massage and the oxytocin. Okay, if the mom after labor, and she started to complain of leg pain and redness, her leg is painful and red, what is your first action? Should you give her some massage on her leg? Huh? If the leg is painful? No. Why no? Because that might be what?
DVT.
DVT is a common complication after labor. So if after labor she got her leg swollen, red, painful, do not massage, because if you massage, you're spreading the blood clot. You will making more blood clots, tiny ones, and they will spread. They might cause pulmonary embolism. They might go to the lungs. They might go to the heart. They might go to the brain. So no massage of this. Remember oxytocin, we give it after labor, not only during labor. Why we give oxytocin after labor, guys?
To help
help
the,
the uterus
uterus contract.
Exactly, to help the uterus to contract, to stop bleeding, or to prevent the bleeding. Okay, for gestational diabetes, she gets type 1 or 2 during a pregnancy for gestational. Type 1 diabetes or type 2? What do you think? Type 1 or type 2? Good job, Zach. Type 2, yes, good job, Cindy. It is diabetes mellitus type 2. Treatment of gestational diabetes. Do we give metformin or insulin? Insulin. Good job, Esmeralda. Cindy, good job, insulin. After labor, do we need to increase the dose of the insulin or decrease the dose of the insulin? Postpartum.
What do you decrease?
It is decreased. So the nurse expect the insulin dose will decrease. Very good. Monitor for hypoglycemia. She might get also hypoglycemia after labor because she might have like her diabetes sign and symptoms will decline after labor. She might not even need insulin, so she might get hypoglycemia. So put an eye on hypoglycemia sign and symptoms. Also improve breastfeeding. Very important to improve the glucose control. So make her breastfeed her kid because that is an proven way to decrease the glucose, to improve the glucose control. So breastfeeding is important. Okay. If you have a baby, like a newborn, and the newborn taking digoxin, guys, and then the newborn vomited the medication, vomited the digoxin, should you give him back the digoxin dose he vomited? Since digoxin is it is never. Good job. Do not repeat the dose if vomited. Why? It's no, Carolina. I agree, but why? We don't repeat the dose if vomited.
It might be the first signs of toxicity.
Exactly. It might be toxicity. Plus, you don't know how much he absorbed, how much it went before he vomit, right? So don't repeat the dose. You could double the dose. Good job. And it could be toxicity, as Claire said. Yes. Okay. We need to, instead of double the dose, what will be the most important step if the newborn vomited digoxin? So I will not give the dose again. What will be my first step?
Check the pulse.
This is if I will give digoxin, I'm going to check the pulse. I will check digoxin blood level. Yes, I will check the digoxin blood level. I will see if we need to give a dose or the dose was absorbed. So digoxin blood level. Okay, what is VSD? VSD is ventricular septal defect. What is that? What is ventricular septal defect? Did you get this or not yet, guys? With theory. Yes or no? No? I didn't get an answer. No. Okay. Zach said no. Okay. So what is VSD? Let's learn this. You will get some of these congenital heart disease. So VSD. Okay. Look at the heart. Look at this picture. Do you see the two hearts? Yeah. One on the left, this is normal heart. It has right side, which has blue color. Left side is red color. Why there is a blue and red? Blue because the right side carried deoxygenated blood. That's why we draw with blue. Left side, it has oxygenated blood. That's why we draw with red. Okay? So VSD is ventricular septal defect. Okay, what is that? The two lower chambers in the heart, we call them ventricles. The two upper chambers, this and this, we call them what? Atrium. So we have atrium, upper chambers, ventricles, lower chambers. The heart has four chambers, two upper chambers, two lower chambers. Atria is the upper one, ventricle is the lower one. So sometimes the baby born with defect or hole between, this is called septum, guys. This is called septum. The wall separating the right ventricle from the left ventricle, we call it septum. Okay? So some babies, they born with this septum, it has a hole. There is a hole between the two ventricles. This is called ventricular septal defect because it's a defect in the septum between the two ventricles. Ventricular septal defect, VSD. Ventricular septal defect. Okay? So, if the nurse monitors a newborn with VSD, what you expect to hear in the heart sound?
A murmur.
Murmur. You will have a murmur because the turbulence of the blood flowing through this hole cause a murmur. So remember, any cardiac defect like VSD or ASD or Fallot, whatever we will study later, this cause murmur. Okay. I shouldn't go deep in that. Just know the VSD, it causes murmur for now. And let me see what else. Make sure with cardiac newborn with cardiac problem, you want to reduce the workload on the heart. How I reduce the workload on a heart for a newborn? He's not doing anything, right? But still, I can reduce the workload on the heart. How?
Provide oxygen. Calm environment.
Calm him down. Yes, Bing, good job. Calm him down. Make sure they don't cry. Don't leave him to cry. If they are hungry, feed them, right? Also, how I decrease the workload. Should I give them like frequent small feedings or like give them complete session of feeding, 20 minutes feeding? Small, frequent. Good job, Benikar. So we need small, frequent feeding. So you will not make the heart try so hard during the feeding. Give them small, frequent. Also, if you're giving formula, make sure the nipple of the formula is big. So they will not make effort in the suction. Because if the nipple is small, they will make effort to suck the milk out, right? Make the nipple hole is big. Make sure the nipple will like get a nipple with a big hole, so that will decrease the workload on them. Yeah, and make sure you give them a formula, high calorie formula, so they will not need to spend long time in the feeding to get their calories. They might get all what they need in like 5 minutes and they got their calories. So small, frequent feeding. The nipple it has a big hole, so he will not work himself out. A high calorie formula. Don't make him cry. Try to console him if they cry. Okay, so that is to decrease the workload on the heart. So that will manage their oxygenation. Okay, what is hydrocephalus? Hydrocephalus. This is, hydro means what? Hydro flask. Hydro means what?
Blood in the
Water.
brain.
Water Yes, fluid, it is fluid in the brain. So hydrocephalus, when there is accumulation of the cerebrospinal fluid. Look at this pretty boy or girl. Look at the head. Is it big or small? Big, full of cerebrospinal fluid, because cerebrospinal fluid filling, this is normal ventricle size, and this is when the fluid increase. That might cause enlargement of the head. So that is so dangerous because that will press on the brain. We need to drain the fluid. How they drain the fluid? They do something called ventriculoperitoneal shunt. So make sure you measure the head circumference, right? Measure the head circumference, and the treatment is VP shunt. Look at this. This is the shunt. What they do, look at this picture. This guy. Do you see this? Yeah? This is a shunt. VP shunt, ventriculoperitoneal shunt. This is the probe inserted in the ventricle of the brain to drain the cerebrospinal fluid down into the peritoneal cavity, into the abdomen. We call it VP shunt. And this probe, it goes behind the ear. So it goes behind the ear, under the skin. So they do this procedure and they keep it changing the lengths of the shunt. If the child get taller, they need to change the length of this shunt when the child get taller, so it will be draining into the peritoneum exactly. So what is a complication of this shunt? What could be a complication? Infection. Good job, Michaela. Infection. Infection. So monitor for any high temperature, because this is an indication of infection. What else could be a complication of the shunt? Ventriculoperitoneal shunt, VP shunt. What else could be a complication?
It just stopped working.
Exactly, blockage. Very good, Marissa. Blockage of the shunt. Maybe it will be clogged, right? So the fluid will back up where? The fluid will not be drained. It will back up to the brain, right? So the child will start to show symptoms. So educate parents to understand how to see changes in their child behavior, like if the child started to get fuzzy, irritated, or refuse to eat, that could be blockage happening. So they need to give us a call right away because that might be blockage. Okay, this is called hydrocephalus and it is treated with ventriculoperitoneal shunt. Okay, let's go back here. So VP shunt, infection, fever, irritability. Okay, we talked about appendicitis. We talked about the parallel plane toddler. We talked about the poor eye contact, delay speech with autism. We talked about scabies. You see this paper, okay? We talked about Pavlik harness. Okay, sports injury, make sure you do the RICE. RICE means wrist, ice, compression, elevation. Immobilization if there is a severe injury. Phantom limb pain, treat with medication and reassurance. Okay, we talked about glomerulonephritis, right? We talked about epiglottitis. Don't examine the throat. Yes. Otitis media, diabetes, mellitus type 1, because it is more common in children. We talked about sickle cell anemia, how hydration is important, how oxygen is important, the hopper, hydration, oxygen, pain medication, and rest. Okay, guys, postpartum complication is top priority in this exam. So you might get postpartum hemorrhage. You might get gestational diabetes. Test favorite is newborn hypoglycemia. Make sure you know what is a newborn normal blood glucose, so you will know what is hypoglycemia is. Digoxin rule. Check the pulse for the whole minute. Less than 100 in infant, don't give digoxin. Epiglottitis, don't touch the throat. Okay, this is the most important notes. Yes. So what I'm going to share this paper with you guys. Yes. And there is one more page. Let me show you. It has more concepts. Let me show you how it looks. So when you receive it, you know what are you receiving. Another paper here. It has more concepts. Not very different. Mostly the same concept, like mostly the same thing. But little bit more concept like hypospadias. Like this word, hypospadias. You know what is hypospadias? Huh? Hypospadias. Let me show you.
Is it when the urethra is not where it's supposed to be? Like lower,
Carolina.
higher?
Very good. Yes, Carolina. So here, you know, guys, where is the urethra? The urethra is at the tip of the glans penis. This is where the urethra. The opening of the urethra, it should be at the tip, right? Like here, like this. The urethra at the tip. So sometimes they born with the opening is at the bottom of the penis, like opening like this. One, it's only one. Don't think he will have all these opening. It is just one, but they show you like it could be here or here or here. Yeah. So this is called hypospadias. The opening is at the ventral surface of the penis. Yes. So the main thing the nurse need to educate the parents about, don't do circumcision now, because sometimes they will use a circumcision skin, the foreskin, to correct this hypospadias. Yes. So this is one of the things. Also, it shows as high yield when I looked at HESIS. Hypospadias, how to collect urine, collection bag, how to deal with choking infant. If an infant is choking, put the head down. How many back thrust? How many? 5. 5 back blows, 5 back thrust, right? Lyme disease also, it is important. So review that. Hydrocephalus and the shunt and the infection. So these concepts, guys, this is what we studied now together. And I put them in a PowerPoint to display it for you, but I summarize it here, all what we discussed in one sheet. So you will have the sheet and listen, you all use AI, right? You use AI, do you? As a way of studying? For sure. Sometimes if you want to study something, sometimes they explain it to you. If you have a topic, you ask the AI to create you questions on these topics. True? Yeah, you use it in a good way. I'm not saying you use it to answer your assignments, which I'm not saying that. I'm saying you're using the AI to study. Yes, and there is a co-pilot. The one in your Canvas. There is AI in your Canvas. You know that, right? Yeah. So you use a trustworthy ones. You may put these topics, or if you have Quizlet, you may put the topics, the concepts I give you, and let them make you flashcards, or you make yourself a flashcards. Yes, and study these flashcards. Also, there's maternity pediatric exams. Do you know where you find them? Yes or no? The maternity peds. Yes or no? You know where are they? There's one in the Burgundy book. Okay, Benikar, you don't know?
No.
Saunders. Okay, let me show you guys here. You have many sources for maternity peds questions. Because as I said, I always give you what I expect. But again, we do our best to make sure we have focused study, but we need to have broader idea because nobody can know what will be in the test, right? And even if you know, we will not share it, obviously. So it is just the best guess based on experience. So here, this is your evolve. Do you see the evolve here? Yeah? So first one here, if you click on this burgundy book, which says HESI Comprehensive Review, click on that. And you click on Student Review Questions. You have comprehensive exams. They will be good for your exits. You have maternity exam. You have pediatric exam. 2 full exams, maternity, peds, okay? Study. Each question will be your tutor. This is one source. Another source, you guys, you have the case study ebook. You have this ebook, the case study. You all work on the case study, right? Do you have this book, yes or no?
Yes.
This one. Yes, so click on it. It
No.
is everyone has it, guys. You have it in your Evolve and in your Canvas. So it has case study and it has practice test. Click practice test on the left.
Wait, we don't
Mater-
have that one. We have regular case studies, but not like this one.
It has these ones. It has these ones. Okay, do you have it on your Evolve or on your Canvas or on both?
Let me check.
Okay, are you on campus tomorrow, guys?
Yes.
Okay.
Yes.
So who will come to my office to show me what you have in your Evolve? Because you might not have the exams activated yet. I can activate the exams for you. Okay, so who will come to my office tomorrow? I need
Me?
one to during lunch or before school. No, during lunch. Before school, I will be home. So yeah, Michaela, you will take care of that. Okay. So Michaela, I will see you during lunch. I will look what do you have on your Evolve. I will work on it to give you full access to all the exams I just showed you. These are all exams you should have access to. I'm pretty sure you have access, but maybe you don't know how to activate them. So I'm going to see one of your accounts, and for sure everyone will have the same thing. They have all exams here. Also, they have comprehensive exams, 3 comprehensive exams. You can work on these exams before your exit. Okay, deal. Michaela, I will see you during lunch. And you guys, I tried to make it so short. I tried to make it focused on the high yield topics. So study these concepts. Also, I'm going to send you these concepts on Canvas. I'm going to send you this as an email on Canvas. I'm going to email them to you. Every one of you will get an email with these concepts. Plus your practice. Yes, Michaela.
I think in the past you've sent documents as a docx, and 'cause I have a Windows computer. Sometimes it's hard to open it. Jose showed me how to do it on Outlook, but would you be able to do it in PDF?
I can do it PDF for sure. Yeah. So PDF is easier.
Yes, please.
Okay.
Or
I
at
will
least I think so.
Yeah, I will transfer it to PDF and email it to you guys. Everyone will receive an email.
Okay, thank you.
Sure. Anything else can I help you with, guys? I still remember we will summarize maternity peds one day, but before your final. We will do that before your final. All the best tomorrow with your management exam, and I'll see you tomorrow.
Thank
Have a good
you.
night.
Thank you,
Good
Dr.
night.
Carol.
You're very welcome. Good luck.